In the briefing just held at the White House, the doctors highlighted states where the outbreak is increasing dramatically. That includes New York and New Jersey. But they also talked about many states where COVID-19 isn't peaking just yet, and that includes Pennsylvania. Health reporter Stephanie Stahl is in another part of our studio with the update. Stephanie.
Well, Jessica, Dr. Fauci said while the numbers will get worse, if Americans stay home, there is a chance the outbreak could be contained, especially in places like Pennsylvania, where there hasn't been a surge of patients yet. That's reflected in new research released today with projections about what's to come in Pennsylvania.
Philadelphia's iconic Love statue is lonely these days, with most people off the streets, heeding the warnings to stay home. While the number of COVID-19 cases and deaths continues to increase, one model from the Keystone Research Center shows a decline in the rate of increase in Pennsylvania.
It seems that the vast majority of people are following our recommendations. There aren't many people outside, and those that I do see outside are keeping a distance.
I think social distancing is really important. If the curve is flattening out, that's probably a good reason for it.
Susan Weiss with the University of Pennsylvania is a world-renowned leader in coronavirus research.
This is a new virus. It's behaving differently from SARS, which is its closest relative.
Dr. Weiss will be the co-director of the newly created Center for Research on Coronavirus at Penn to work on potential vaccines, treatments, and diagnostic tools.
One thing about this virus that isn't so much about the virus itself, but the fact that there appear to be virus can spread before there are actually very dramatic symptoms, allows the virus to spread among people before we know who's sick or who's not sick.
The Keystone Research estimates the coronavirus will kill 3,000 in Pennsylvania by August 1st, and that hospitals will see a surge of almost 10,000 patients on April 17th. Professor Weiss says she never imagined a pandemic could be this impactful.
I'm pretty shocked, but we should have been warned by what happened with SARS and MERS, SARS in particular. Again, SARS was a really bad virus.
Now, SARS was another coronavirus that spread globally. The current outbreak has been more widespread and deadly, but research done with SARS could be helpful in fighting this COVID-19 outbreak. Jessica?
Stephanie, thank you.